Hello students, today we are going to discuss about the pathophysiology of Parkinson's disease. So this Parkinson's disease is nothing but it is one of the disorders of the nervous system. Okay, so this is mainly going to affect part of the brain called as a substantia nigra. Okay, so because of denaturing of the cells of substantia nigra, this Parkinson's disease is going to be seen. So it is nothing but the Parkinsonism is nothing but loss of control of movement. We call it as a loss of control of movement. That means the persons whoever are having this disease, they cannot move their body parts properly like hands or legs. There will be a tremors. There will be shaking in the hands like that. Suppose if they want to reach this pencil like this, it will be shaking. They cannot hold the pencil. Even when they hold the pencil, they will be the writing and everything will be disturbed because continuously their hands will be shaking. Okay, so why this Parkinsonism? Earlier, this Parkinsonism is called as a shaky palsy. Okay, it is called as a shaky palsy, and it is because when certain nerve cells in the brain are going to die or when they become impaired, especially the cells in the substantia nigra. So why only if the cells in the substantia nigra are going to denature, it is causing the Parkinsonism? Because the substantia nigra is going to produce a chemical called as a dopamine. So this dopamine is a neurotransmitter. When this dopamine is not produced properly, then there won't be any coordination in the functioning of body's movements and the body's muscles and the movements. Okay, that means this dopamine is responsible for the smooth coordination of the body's muscles and the movements. So what happens when there is a denaturing of the cells in the substantia nigra? Those substantia nigra, it is not going to produce the dopamine. So when dopamine is not there, there will be disturbance in the coordination between the muscles and the movements. So when does this Parkinsonism happens? It is not just like if only 10 or 20% of the dopamine is not there, then it is going to cause the Parkinsonism. When 70% of the dopamine producing cells are damaged, okay, when 70% of the dopamine producing cells are damaged, then it is going to initiate the Parkinsonism, and it is regarded as a one of the most common neurologic disorder affecting approximately 1% of the individuals above 60 years of age. So this disease is caused in the older age people, especially above 60 years of age. And this progressive movement disorder, so because of this Parkinsonism, what actually happening is there will be certain tremors, rigidity will be there. That means a person cannot be able to move the limbs, and slow movement. This slow movement is called as a bradykinesia. Okay, bradykinesia is that the person cannot walk faster or they cannot walk as normal. Okay, and also there will be posture instability. Posture instability is nothing but they cannot stand straight as well. Okay, they cannot stand straight as well, so that we call it as a posture instability. So Parkinsonism, it is a loss of control of the movement, and it is especially occurring because of denaturing of the cells that are present in the substantia nigra. So why only with the substantia nigra? Because these cells are going to produce a dopamine. Dopamine is a neurotransmitter or a chemical which is used in the coordinated movement, coordination between the muscles and the movement. So when cells in the substantia nigra are degenerated, they are going to not produce the dopamine in sufficient amount. So for that reason, if 70% of dopamine producing cells are damaged, then they are going to lead to the Parkinsonism. So this Parkinsonism is going to cause the tremors, rigidity, instability in the posture, and bradykinesia. Okay, now let us see what is the etiology, like what causes this Parkinsonism. Obviously, just now we have seen that when the cells in the substantia nigra are going to degenerate, then it is going to cause the Parkinsonism. So this is an immediate cause. So whenever the cells in the substantia nigra are degenerated, immediately it is going to cause the Parkinsonism. So this substantia nigra is a part of the brain which is going to control the principal movement control centers in the brain. So whatever the movements that we are making, all these are controlled by the substantia nigra that is present in the brain. So as it is releasing the neurotransmitter called as a dopamine, this dopamine, when it is released, it is going to stimulate another center in the brain called as a corpus striatum. Okay, it is going to just stimulate the part of the brain called as a corpus striatum. So when dopamine is not produced properly, this corpus striatum is not going to get stimulated. So what is the role of this corpus striatum? It cannot control the movements. The corpus striatum cannot control the movements. So here you can see, without enough dopamine, corpus striatum cannot control its targets, resulting in improper movement patterns of walking, writing, reaching for the objects. That's what I said. So when we are holding a pencil, we cannot hold it properly. There will be the tremors like this. Okay, and even when you write it on the paper, the tremors will be shown on the paper, and also the person cannot reach to the object properly because as there are much tremors in the hand. Okay, the cause for the Parkinsonism is unknown, though we say that the Parkinsonism is caused by the denaturation of the cells, degeneration of the cells in the substantia nigra. But still, the cause is unknown. We doesn't know whether because of degeneration of the cells, the Parkinsonism is caused, or because of Parkinsonism, the cells have got degenerated. So, though the cause is unknown, there are several factors that are involved in the occurrence of this Parkinsonism. So, let us see what are those causes. So here, the causes of the Parkinsonism, it includes the genetic causes. So there are two types of proteins called as a alpha-synuclein and parkin. These two proteins are responsible for the Parkinsonism. So if many of the family members are containing these two proteins in their body, then there is most chances are there for the next generation people to have this disease in them. Okay, so alpha-synuclein and parkin are the two proteins. And also there is a system called as a ubiquitin proteasome system. When this particular system, we call it as a UPS. So when this system is dysfunction, it is not functioning properly, then what happens? There will be the accumulation of misfolded proteins and endoplasmic reticulum stress is seen. Because of this misfolded proteins and endoplasmic reticulum stress, it is going to cause the death of the dopaminergic neurons. So when the dopaminergic neurons are going to be killed, when they are died, what happens? It is not going to produce any dopamine. So in Parkinsonism disease, a degenerating brain cells. So whatever the brain cells that have been degenerated, they are producing a certain types of the substances called as the Lewy bodies. Okay, they are producing certain type of substances called as a Lewy bodies. So these Lewy bodies are used to identify the disease. So generally, if both of the proteins like alpha-synuclein and parkin are present in the most of the family members, then there is a most chances are there for the next generations to have this disease. Okay, so not only those two proteins, if there is any dysfunctioning of a system called as a ubiquitin proteasome system, what is this dysfunctioning of the system leading to misfolding of the proteins as well as the endoplasmic reticulum stress. So because of these two conditions, there is a death of the dopaminergic neurons, and whenever these brain cells have been degenerated, especially the substantia nigra, when the cells are denaturated, they are going to produce the substances called as the Lewy bodies. And these Lewy bodies, presence of these Lewy bodies are going to help in identification of the disease. And what are these Lewy bodies? These Lewy bodies are nothing but the clumps of specific substances within the brain cells, and these are considered as a microscopic markers. Markers in the sense to identify anything will be having the markers. So in the same way, to identify the Parkinson's disease, we take these Lewy bodies as a markers, and the presence of these Lewy bodies will give an important clue for the presence of the Parkinson's disease. And also alpha-synuclein. Alpha-synuclein, it is the most important and the widespread protein that is found in the Lewy bodies. Okay, so and again, Other than these, we have, so first we have seen about the genetic causes and also the presence of Lewy bodies. So presence of Lewy bodies, how the Lewy bodies are being present, they are the chemical substances which are produced because of the denaturation of the substantia nigra cells. And then it is cell death in the Parkinsonism is maybe due to infection, trauma and poisoning. So these are also the causes. Ultimately, see here, ultimately what is the main reason for the causing of Parkinson's disease is it is a death of the cells. So what causes the death of the cells? Okay, so the next reason is it may be the death of the cells may be caused because of infection, trauma or also poisoning. And sometimes the drugs may also cause the denaturation of the cells. So the drugs include haloperidol, chlorpromazine. Okay, all these are the drugs which are involved in causing the death of the cells that are present in the substantia nigra. And early exposure to some unidentified environmental toxins or virus also lead to the undetected nigral cell death. Even some environmental factors are also responsible for causing of this Parkinson's disease. And sometimes some people genetically, like by birth itself, they are born with a fewer cells, like very less number of cells in the substantia nigra. We doesn't know what is the reason. So it could be a genetic cause. So there will be less number of the cells that are present in the substantia nigra. So when less number of cells are present, it cannot produce the dopamine properly. When dopamine is not produced, then it is not going to function the coordination between the muscles and the movement. Okay, so all these are the causes. The main cause is the degeneration of the cells in the substantia nigra. So for that, there is a production of the Lewy bodies, and these Lewy bodies are responsible for the detection. They are used as a biomarkers, identifying markers for the Parkinson's disease. So how these cells are dying, it may be because of the infection, trauma, or exposure to the environmental factors or to any drugs. Okay, and also sometimes the people will have very less number of cells in the substantia nigra. Okay, then coming to the pathophysiology. So here, whatever may be the cause. See, always the pathophysiology starts with the cause. Okay, so here let age be the cause. We have seen in the introduction that above 60 years of age, there is more chances for the occurrence of this Parkinson's disease. Environmental factors may be there, excess of iron may be there, and excitotoxicity will be there. So because of all these reasons, there will be mutation and presence of alpha-synuclein and Lewy bodies are present. So how this mutation is happening and how the presence of this alpha-synuclein and Lewy bodies are present is again unknown. So when it is happening, it is going to result in three cases. The first one is protein aggregation and glial activation is going to be done. Mitochondria is not going to function properly. And the third one is there will be increased oxidative stress and lysosomal dysfunction. All these three conditions, protein aggregation, mitochondrial dysfunction and increased oxidative stress, it is going to cause the apoptosis and neuronal cell death. So when the cell death is there in the substantia nigra, it is leading to the symptoms of the Parkinson's disease like bradykinesia, that is restricted movements, tremors, impaired sleep, behavioral changes, and all those things are going to be caused. Okay, so this is the pathophysiology. Coming to the symptoms. So these are the non-motor symptoms, that is possible early symptoms we can see. Initially, the person will lose the smell. Okay, so as the muscles in the nose, they are not going to be coordinated and there is a loss of sense of smell will be there. And then drooling will be there because the lips of the patient cannot be closed properly. They cannot close properly. So that is the reason we call it as a drooling will be there. Because of the space present between the two lips, there will be the drooling. And then constipation and gastrointestinal problems will be there. Sleep problems will be there because there will be tremors, not tremors, there will be aches in the muscles that are present in the legs. And also mask-like facial expression will be there because as they are not going to control their movements in the facial, they are not able to control the facial expressions. We call that mask-like expressions will be there in the face. So, and then common motor related symptoms include slowed movements. So, the person cannot move faster. Tremors while muscles are at rest. Even when they are not doing work also, their muscles will be at tremor. And rigidity or stiffness, especially at the joints. They cannot move properly. And then blinking of the eyes are very less, because even the muscles in the eyes, they are also at problem. That is why they cannot move the eyes properly, blink the eyes properly. And even they have trouble swallowing, because the muscles that are present in the throat are at a problem, so they cannot swallow properly. And here it is a like instability in the posture. See, here you can see the person has been bent. He is not straight because of the posture problems. They are going to be just bent. They are not normal. So these are the early symptoms, and these are the most common motor related symptoms. Then let us see how we can diagnose. So no distinctive tests are there for the Parkinson's disease. As I already said, there are the markers. If Lewy bodies are present in the body, then we can call it as, we can suspect that the patient is having the Parkinson's disease. And variety of lab tests may be done to rule out other causes of the symptoms. We doesn't know why the, maybe because of inflammation also, inflammation in the throat also, it may cause the swallowing problem. Okay, so to rule out, we are going to test all the symptoms. And other tests include brain scans, blood tests, lumbar punctures, and alpha X-rays. Okay, so here the 4 types of the diagnosis we can do is by the biosensors. Imaging is nothing but by doing the scans. Clinical abnormalities like presence of Lewy bodies we are going to see, and novel concepts is like breath tests. Okay, even in the breath also they can detect this Lewy bodies, and they can identify if Parkinson's disease is present or not. Okay, this is how we are going to diagnose. And then coming to the treatment. So here we will go with the treatment depending upon the symptoms. So if a person is having a Parkinson's disease, impairment of activities of daily living with functional impairment and or quality life issues. If they have any problem with functional impairment, and also if they have any quality issues with the life, like the person is not able to hold the objects, or can't move properly, are not able to swallow, unnecessarily they are drooling, like that, if any symptoms are not there. Okay, if no above symptoms are there, then only non-pharmacological treatment will be given with or without MAO-B inhibitors. Okay, and then if all these symptoms are present, these first symptoms are present, then again they will see whether they are cognitively intact or cognitively impaired. Their cognition, it is going to be seen here. So if they are cognitively intact, that means they don't have any cognitive problems, then they are going to be treated with dopamine agonist, anticholinergics, amantadine, levodopa, carbidopa, or another drugs, along with the combination of either whether may or may not MAO-B inhibitors. And rescue therapy is with the apomorphine. But they are having the cognitive problems, okay, that cognitively impaired, they don't have the cognition. Then they are going to be treated with Stalevo or levodopa and treat the non-motor aspects, avoid anticholinergics and amantadine. Okay, suppose if they are cognitively intact and their disease is progressed, then we have to go for the surgical therapy, DBS we call it as. So that DBS is nothing but deep brain stimulation. Okay, DBS is nothing but the deep brain stimulation. This is a surgical aspect that we have to go for the treatment of the Parkinson's disease. Okay, so this is all about the Parkinson's disease. So we have seen about what is the Parkinson's disease and what is the main reason and various causes of the Parkinson's disease. We have seen about the pathophysiology, and then symptoms, diagnosis, and the treatment. Okay, so this one can be asked probably in the short answer questions for 5 marks. So I always suggest you to put it in the form of a flow chart, whether it is a pathophysiology or treatment. Even treatment also here you can put in the form of a flow chart. Okay, thank you.